of experience in different senior positions in state and central governments and the Indian embassy in Germany. In his present capacity, he deals with matters relating to food grain management in the country for the central pool stocks, including procurement, storage, and movement of wheat, rice, and coarse grains for its further distribution through the network of public distribution system outlets. He also deals with the policy intervention for the sugar and edible oil industry in the country. Administration of the National Food Security Act 2013 is one of his major responsibilities. Moving on, Major General Bidal serves currently as the Executive Director for the National Institute of Disaster Management, NIDM. He was commissioned into the Corps of Army Air Defense in December 1985. During his more than 3 decades of service, he has held important command and staff assignments, including the Provost Marshal in the United Nations mission in Mozambique. Under his leadership, the NIDM continues to play a critical role of bringing disaster risk reduction to the forefront of the national agenda. The Institute also supports and engages with various ministries and states to build capacities on disaster risk reduction. Mr. Nicola Bidal is the Senior Regional Program Policy Officer for WFP Regional Office of Asia and the Pacific in Bangkok, and he manages the research, assessment, and monitoring agenda for the region. Prior to this, he was the Deputy Global Coordinator of the UN Network for Sun, which is scaling up nutrition, originally founded by WHO, UNICEF, WFP FAO, and later was joined by IFAD. Nicola has a long career in the monitoring and data analytics in various UN agencies in Africa, Latin America, and Asia. He was also in the 2010-2011, he was the chief of the monitoring unit in our headquarters in Rome. Lastly, we have Ms. Yumiko Kanemitsu, and she's the Regional Evaluation Officer in the WFP Regional Office for Asia Pacific in Bangkok. As a professional evaluator with more than 20 years of experience, Yumiko's work includes evidence-based policymaking, including results-based management for various socioeconomic development areas for leading international institutions, and particularly focusing on food security, human rights, and gender. She also works on building a harmonized multidisciplinary approach to development in all SDG areas. It's a lot of work. So we look forward to the valuable insights and guidance from all of our panelists to guide us over the next hour of discussion. The topic for today is remote monitoring of food security and nutrition for improved results. With only 10 years remaining to achieve the SDGs, it's critical to provide stakeholders at all levels with accurate, timely, and actionable data for maximizing results of programs. While India has made rapid gains in reducing food insecurity through its large public programs, such as the Targeted Public Distribution System, the midday meals for school children, and the Anganwadi services, more efforts are required to achieve the targets under SDG 2. Persisting rates of undernutrition for critical age groups in vulnerable communities and other challenges in food security and nutrition are particularly worrisome for all stakeholders. At the same time, several parts in India remain vulnerable to disasters and crises. Learning from the recent COVID-19 pandemic, we know that ensuring food, water, and shelter are crucial to the disaster relief measures and efforts of building back better. We also know that governments around the world are facing tight fiscal environments and limited resources while having to deliver more services at a better quality. So for now, we need to strengthen the food security and nutrition monitoring system, which will enable government to track critical information and provide timely support to vulnerable communities and individuals who need it the most. So this brings us to the 4 main questions we hope to answer during this session. The first one is, what are the current challenges and opportunities to strengthen food security and nutrition monitoring, both in the normal settings and during a crisis? The second one is, how do we leverage new and emerging technologies and tools to help the government track effectiveness of the food security and nutrition programs? Third one would be, what are the pathways for evidence to result in effective decision-making and maximizing returns from the public expenditure in food security? And lastly, and most importantly, what are some of the solutions that we can test today to support the government in achieving zero hunger? What are the best practices emerging from India and other countries? It's a big agenda, but we hope to be able to shed some light on this in the course of the discussions. So now we have this, I don't know, graphic that we developed to look at the framing our discussion today. We discussed together kind of creating a cycle on looking at its different stages where you need information in order to guide responses and also decision making. So you see stage 1, 2, and 3 is basically setting up and establishing a baseline of information, which will provide coming to central or to the decision makers. So you understand what the norm is in understanding food security and some of the issues that are affecting it within that context. Then if you have a crisis, which we see in stage 4, you see stage 4, 5, and 6, you have the crisis, which then has an impact or not on food security and nutrition, and you need to know who and how, you know, how deeply are they impacted. So this information system can continue to provide information, which can then be compared to the baseline or the normal period in order to look at the depth of the crisis and how many people were and how deeply they were affected. And then you have the remote monitoring for post-crisis to assess the recovery phase of the people that were affected by the crisis. So the third group of stage 7 and 8, you're looking at evidence-based program design and targeting for the long term, because this information is not only for action, but it's also for learning and for then retrofitting or trying to improve your programs in order to then reduce the impact of the next crisis. So you're looking at food security outcomes, you're looking at mitigation and resilience building in stage 8. So just in a nutshell, this is kind of looking at the monitoring cycle. So we want to know these challenges and opportunities, both in normal and in the crisis, and then what are the best practices, to reiterate some of the questions. So now I invite the panelists to share their views. So let me start, please, with Mr. Sudhanshu Pandey. Mr. Pandey, would you please like to speak for the panel?
Thank you very much, Eric. Good afternoon to everyone, including my fellow panelists. I would be very brief and confine myself to next 8 to 10 minutes. Next. The structure of my presentation is number bullet 1 and 6. I will not dwell upon more in detail. Highlights of the National Food Security Act, government's food security response during COVID-19 pandemic, understanding the need for evidence-based evidence during different phases of the crisis situation, tool and technology used by Government of India to address the evidence need, technologies innovation to track food security system, end-to-end computerization helping in the public distribution system, initiative taken by our major food grain storage company, Food Corporation of India, and experience and lessons from the crisis management during COVID-19 period, and what are the possible way forward. Next. So very essentially, just to summarize this slide in 2 points, food security became legal entitlement in India from 2013, and from 2016 all states have adopted it. Now under this law, 67% of the Indian population, 75 minimum up to rural and up to 50% of the urban, they are covered, and they together constitute roughly about 810 million people in the country. Another thing that has happened, that the food grain that is made available to them now across India, the prices are rupees 3, rupees 2 and rupees 1 for rice, wheat and coarse grain. So you can imagine that what kind of subsidy Government of India extends. Next. Now, what has been the pandemic has been a century's worst disaster, I would say, and our food security response to this so far, the reports that we got from independent bodies and agencies has been quite satisfactory. We distribute roughly about 550 lakh metric ton, which is about 55 million metric ton of food grain across India every year. During this pandemic, we augmented that supply by another 32 million metric ton, 321 lakh metric ton of additional food grain, which was free of cost. It was distributed across the length and breadth of the country, and you will see in the distribution, we had to use ships, we had to use aircrafts, we had to use trains, we had to use road transport. And since most of the logistic chain was free in that sense, because rest of the economic activities were down, we were able to very swiftly move all this food grain stuff to a remotest part of the country. Next. Now, it's extremely important that the 67% of the population, which is intended to be served, whether they are getting served or not. This is a very important point. And whether they are getting this delivery on time or not. Therefore, we have a cycle of distribution of these food grains across India. It differs from state to state, but it reasonably ensures through the biometrically authenticated distribution that food grain is rightly targeted to people. Also, within this population of 810 million people, we have about 100 million people who are from the poorest of the poor families, and they get covered under the Antyodaya Anna Yojana scheme, where we supply approximately 35 kg of food grains irrespective of the size of the family to every family of this category, which is much more than what we supply to other households. Next. Now, how do we leverage technology? Now, this is extremely important. A lot has been spoken about Aadhaar, which is a very unique identification, biometric authentication system in India. Now, what we have been able to do, we have been able to use Aadhaar for distribution of food grains through the public distribution system, and we have central repository of data. We have a central Anna Vitrana portal through which every minute real-time monitoring of the distribution of food grain is possible. So whenever any beneficiary draws his food grain anywhere in India, he will be clocked and registered in our portal. And this also ensures maintenance of a very efficient supply chain, because we know how much is being distributed, how much more supplies have to be replenished, as a result of which we are able to maintain uninterrupted supply chain. We have national helpline numbers also. 2 numbers have been given in this series, and anybody can register his or her complaint using these helpline numbers. Next. End-to-end computerization, as I said, right from procurement to distribution. Now, distribution part has been covered. Now we are trying to take it backward to even the procurement. And in 4 Indian states, even procurement is now biometrically authenticated, either using the fingerprint or using the iris. Next. Now, this is what I meant by end-to-end computerization. If you see 100% digitization of the entitlement card for the food grain, which we call as ration card, has been done. 91% of these ration cards have been seeded with a specific identification number, which is the Aadhaar number, and then online allocation of food grain for all fair price shop. This distribution outlets is happening in 34 of the 36 Indian states. The supply chain management has been automated. Out of 36, 31 states have implemented it fully. Grievance redressal is implemented in all 36 states, and fair price shops, which is a vast network of almost 500,000, outlets, 92% shops have been automated through the electronic machine, distribution machine, EPOS, what we call. Next. Now, how do we use all this? As I said, procurement is done by FCI and the state government agencies, and from there the technology is used. And the DOS system, which is the depot online system, we have implemented in FCI. All FCI owned depots, they have been computerized, and we are also in the very advanced stage of implementation of hired storages go down of the FCI. Same thing is happening now. What we are doing, the state godowns and the central godowns, their integration is also happening. In some state, it has already happened. So seamless distribution of food grain getting transferred from state warehouse to the central warehouse to the state warehouse is happening, and then downward distribution is happening. Next. Now, this was the exceptional mobilization during the COVID time. We procured food grains during the Rabi season. Wheat was procured. It was almost 390 lakh metric ton, which means roughly about 39 million metric ton. This year, paddy procurement is still on, and we are expecting that we will cross 77 million metric ton target for paddy procurement also. But in order to match this and to fight the COVID, that the farmers don't suffer, we increase the number of procurement centers across India by very significant number. Next. As I said, during this period, we ensured that all the COVID protocols, they were followed, right from the procurement centers to the storage godowns, logistics chains, and the distribution center. All protocols, World Food Program has been working with us. They are aware that how these protocols were implemented even in the remotest part of the country, and that is why perhaps even COVID spread could be checked and reduced. Next. Now, what are the lessons and what is the way forward? This is my last slide. Advanced early warning system in the crisis management is very, very important. We experienced that during the COVID-19, we were actually caught totally unaware. There was very little advance intimation. Second, the real-time flow of information, that was also a problem during this period because it was a completely new kind of disaster. Nobody knew. Everybody was struggling to find out. Seamless integration of not only national and state information system, but also international information sharing, because this is a global pandemic, and here international information is equally important if we have to effectively handle the domestic situation. Data as decision support system need, data availability. If you recall, India has been maintaining a very robust data system for the COVID and the food grain management, and we were able to handle this. All our interventions were technology driven. Even during the migrant crisis, we handled that with the intervention of the technology across all states. Citizens' participation through regular interaction using multiple media channels for communication has been one of the important lessons that we gain. So I would like to thank Niti Aayog and WFP for giving me this opportunity to share some of the fantastic experience that we got during this worst crisis of the century. Thank you.
Thank you so much, Mr. Pandey. And now, moving forward, would I like to call on Major General Bindal, please, to share with us some information on NIDM's work.
Thank you, Eric, and I wish all the esteemed panelists a very good morning and all the participants who have joined. Good session. We are aware that the 2030 Agenda for Sustainable Development puts forward a transformational vision, which is recognizing that our world is changing, bringing with it new challenges that must be overcome if we are to live in a world without hunger, food insecurity, and malnutrition in any of its forms. The world population has grown steadily, with most people now living in the urban areas or moving to the urban areas. Technology has evolved at a dizzying pace, while the economy has become increasingly interconnected and globalized. Many countries, however, have not witnessed sustained growth as part of this new economical change. The world has seen significant progress in reducing hunger over the last 15 years. Yet nearly 793 million people worldwide still lack access on a regular basis to adequate amounts of dietary energy. This means that we are far from achieving the goal of eradicating hunger. The Food Insecurity Experience Scale, FIES, it provides a very new and improved measure of food insecurity, focusing on the access to food. So based on a preliminary assessment of worldwide data collected at the individual level, Sub-Saharan region is the region with the highest prevalence of food insecurity. And the results also suggest that food security is more prevalent among adult women than among adult men almost everywhere. International agreements have been reached on key indicators to monitor progress towards Sustainable Development Goals, point number 2. But considerable data gaps and methodological challenges remain that need to be overcome to measure food security and nutrition effectively in a timely and across country comparable way. Or possibly even larger challenge is to find effective ways to monitor implementation of this new agenda and its integrity. The world has seen, for the developing regions as a whole, the MDG targets to halve the proportion of undernourished in the total population was nearly achieved. The persons of undernourishment decreased from 23.3% in 1992 to 12.9% in 2014 to 16 period. And the most ambitious target set by the World Food Summit in 1996 to halve the number of people suffering for hunger, however, was missed by a large margin. The model approach to estimate the prevalence of undernourishment integrates information that is available with sufficient regularity from different resources from most countries of the world in a theoretically consistent way, thus providing one of the most reliable tools to monitor progress towards reducing probable hunger. While malnutrition encompasses multiple manifestations of nutritional failures, the SDG 2 nutrition indicators only include cause unspecific outcome measures such as child height for age for stunting and child weight for height, wasting and overweight indicators. So indicators of micronutrient deficiencies, notably of minerals and vitamins, typically measured by biochemical tests or clinical manifestations, are not considered. Moreover, neither the WHO Global Health Assembly targets nor the SDG nutrition monitoring indicators comprise measures of dietary quality, which are a major determinant of both of under or of over nutrition. So the 2030 Agenda for Sustainable Development Goals is the result of 3 years of global participatory efforts to make sure that the complex nature of sustainable development is fully recognized. The most daunting measurement challenge is to disentangle these complex phenomena into measurable parts without losing sight of the integrated whole, the relationships among them, and the many important aspects that elude measurements. So there is a need to promote innovative ways of data collection, including through tablets and mobile phones, particularly in remote and inaccessible areas. Improved collaboration among agencies is needed to share costs of data collection, ensure quality control, and the validation of indicators used for global monitoring of food security and nutrition in the context of a universal agenda. The international community has entrusted this role of coordination and technical oversight to the Interagency and Expert Group IAEG on SDG indicators under the auspices of UN Statistical Commission. It is hoped that the incentives created by the need to effectively monitor the 2030 agenda for SDG will promote data collection efforts capable of results that can be disaggregated at the subnational level and which will enable analysis of the food insecurity and nutrition situations according to the socioeconomic status, gender, age, race, ethnicity, migratory status, disability, geographical location, and other policy relevant characteristics of the population. This will require political will and allocation of human and financial resources. The information gaps are many, complicated by the limitations of the methods at our disposal, and the considerable human and financial resources required to collect high quality data on a regular basis in all regions. However, the commitment of the Food and Agricultural Organization, IFAD, and the WFP in particular has been to significantly step up the efforts to address the many inequalities at the root of hunger and food insecurity. India, with 2.5% of the global landmass and 16% of the global population, recognized the importance of human resources as the engines powering national development and gave high priority to improvement of the health and nutritional status of the population. Article 47 of the Constitution of India, it states that the states shall regard raising the level of nutrition and standard of living of its people and improvement in public health among its primary duties. India's 5-year plans enunciated the policies, laid down multi-pronged strategies, which were just enumerated by the previous speaker, outlined multi-sectoral programs to improve food security and nutritional status of the population, laid the goals to be achieved in a specified time frame, and provided the needed funds to implement the interventions. As a result of these interventions, famines and severe food crisis insecurity, food insecurity are no longer a threat. But even today, seasonal food insecurity is seen in different pockets of the country, which are not insurmountable. There has been a substantial reduction in severe grades of undernutrition and micronutrient deficiencies, and some improvement in the nutritional status of all segments of the population. However, in the last 5 decades, the rate of decline in undernutrition has been very progressive, and the mortality rate has come down 50% and the fertility rate by 40%. But the reduction in underweight rate is about 20%. India has been in the forefront in developing national food and nutritional databases, undertaking research studies and surveys, documenting the ongoing agriculture, food, nutrition, and health transitions. Indian scientists have contributed substantially to the global efforts to review the ongoing transitions and evolve appropriate definition of food security, recommendations regarding human nutrient requirements, and develop appropriate standards for assessment of nutritional status. The country has also utilized the evolving knowledge and invested in evidence-based intervention programs to improve food and security, nutrition security to the citizens, ensure that the ongoing food supplementation programs provide sufficient food to meet the energy or the nutrients gap in vulnerable segments of the population, and nationalize and improve ongoing nutritional interventions aimed at prevention, early detection, and effective management of under and overnutrition. In 1950s, India, being the second most populous country in the world, was not self-sufficient in food grain production and had to import wheat. The continued high fertility and total fertility rate and relatively lower mortality resulted in high population growth rate and consequent increase in projected food requirement. Due to multi-sectoral initiatives, the Green Revolution, India achieved self-sufficiency in food production to meet the needs of the growing population and built up adequate buffer stocks within a decade. In retrospect, the Green Revolution can be termed as a successful mission mode for self-sufficiency in food production. Public initiatives by the government and private initiatives, which was the farmers' private property, land is the farmers' private property, that partnership with the private and the public to achieve self-sufficiency in food grain production has gone a long way. It remains to be one of the best examples of what could be achieved if agriculture scientists, economists, and nutrition scientists pulled together. There is a growing recognition that monocropping with cereals has adverse impact on soil nutrition. Agricultural scientists and nutritionists in India joined hands in the advocacy nutrition orientation of food production policies for sustaining an evergreen revolution which will maintain both soil and human nutrition and health. Health professionals have always been concerned about the loss of nutrients during illness and stress on the importance of safe drinking water and environmental sanitation in preventing infections. National rural health missions aims at convergence between water, sanitation, education, and nutrition with various health programs. The country is trying to implement comprehensive programs to ensure improvement in nutrition security, nutrition, and health status of the population. Various measures which have been taken, large number of them have been spelled out by the previous speaker, also include revision of recommended dietary allowances, RDA for Indians, revised RDA, poverty and food insecurity, revised RDA and food supplementation programs under ICDS,
So we need to wrap
and
up to go
usefulness
to
of
the
low
next one.
BMI in adults. I'll do that. And usefulness of low BMI in adults and underweight and under 5 as indicators of food security. So the steep rise in underweight rate occurs between 3 to 23 months of age and is related to poor infant and young child feeding practices, which are not directly linked to household food insecurity. In India and South Asia, stunting rates in preschool children
Okay,
are
so
high.
we
Stunted
need to
children.
move to the next speaker, please.
Okay.
Please wrap up.
With this, I think that India has taken a large number of strides to improve the food and nutrition security, and already measures are in place to ensure that. And between the two speakers from the Indian government, I think the perspective of the Indian government has been put forward. Thank you so much.
Thank you so much, General. Okay, now to our next presenter, Mr. Nicola Bidal from WFP Regional Office in Bangkok. Nicolas, over to you, please.
Thank you, Eric, and good afternoon to the distinguished panelists and participants. I will focus my talk on elements that came very clearly as critical from the two panelists before. One is the importance of technology, the importance of decision support systems, and with a view to be able to advance early warning system, but also very importantly from Major General Bidal, the importance of closing the information gap and generating high quality data when needed and where needed. So how do we do that? Let me share with you some experience from the World Food Programme. Next slide, please. So the good news, if we are talking real-time information, is that it's already part of our lives, right? We used to be very manual on the left side, the gray picture, but now we have access to all this technology that make it possible to have real-time information. Next slide, please. Okay. Click. Okay. We're also becoming more used to getting more information. The demand for real-time information is there. And I think what we've realized with COVID-19, as me, I was every day jumping on my phone to get the latest update, or where is the cases, the death and everything. There's the demand for that real-time information is becoming important for the government, but also for the individual. Next, please. Now, when it comes to food security and nutrition, this is not the same story. When we talk about food security and nutrition, we tend to rely on only partial information. Often, what we see is that information is more from the supply side. You know, we talk about food security, related to the crop production figures, to the distribution figures, those elements from the supply side, but often we are missing the information from the demand side and the household level side, and we've heard that from the two speakers before. The information from the household level comes also very periodically. We have the major surveys every 3 to 5 years, and you know, with representation at maybe at the national level, the provincial level, but we're not really able to have more granular information to be able to zoom in the areas where we need, when we need it. And this is where we need to shift to more real-time information from the demand side, from the household level side. We've seen all the progress that's been made in India on the PDS, getting that real-time information from the supply side. But what about the real-time information from the demand side? We need to understand better the intra-household food security and nutrition dynamics, looking at consumption, looking at diet pattern, diet diversity. We've heard that before also, looking at expenditure, how much is spent by the household on food, and looking at the coping strategies. We need to link that better with shocks and economics. When we have economic shock, for example, COVID has been an economic shock for many people. What has it been the trend over time? Looking at the economic shock, looking at the intra-household consumption and the changes of that. We need to be able to be more agile in the way we're looking at that information, not just national, not just subnational, provincial level, but what about those hotspots that we know are coming? We know the areas that are going to see a drought every year. We know when this is happening, yet we're missing the zoom in into that right place at the right time. So we have the information that we need at the time to be able to be more effective in our response. Missing a bit on this point is also the fact that how from the intra-household level is how the food is used, how also the distribution is used. We've heard about the PDS system being distributed to the household. Do we have information of how that has changed the consumption pattern, how households have used that information? So moving from just the assessment I've just described to more of a monitoring of what we call in WFP a post-distribution monitoring. Now, we have a lot of data about prices, the change in prices. Now, if we start to combine price information and market information with the intra-household, then we can also we are able now to generate more sophisticated analysis in terms looking, for example, at the issue of affordability of the households. You know, we know the consumption pattern, we know the income, we know the expenditure. If we match that with the price of a basket and the price of a nutritious basket, the price of a healthy basket, then we can start to look at the share of the population that are not able to afford that basket. Next slide, please. Okay, we have new technology and new approaches, and we've heard before the importance of relying on mobile data collection. There's many different advantages of moving to that. What we've done in WFP is we've very much worked to generate high frequency, we call it high frequency data collections in many countries. And this is information in some situations, it's daily information, weekly or monthly information on food security and nutrition at the household level. We also combine with information from the retailer and the market price in some places, but very much with a view to get the information at the right time, near real time, to be able to respond better. We use data call centers. We use a set of indicators that are adequate for mobile phone data collection, and there are some restrictions to it. But very much looking at food security situation in a country and be able to zoom in those particular areas of interest. We can also collect, and we've done that a lot with COVID, looking at also some of the poverty element, the multi-dimension poverty, the multi-dimension deprivation index, for example, or wealth index, and then bringing all that together with as much automation as we can into dashboard for the near real-time or real-time information. So technology is out there, and it's possible to rely on this most advanced technology. Next slide, please. In WFP, this near real-time from mobile phone, high-frequency data collection to all the way to automated dashboard, we have it in about 40 countries in the world. Most of it in Africa region, but also there's some high frequency in the Cairo, Middle East region. And in Asia, we have high frequency in Afghanistan. We have established just recently also a coverage through the Pacific office into five countries, 5 Pacific island countries coming together with real-time high frequency data collection. Next slide, please. Just to give you an example of how that information was used. So in Madagascar, for example, having that high frequency on a regular basis being collected from the subnational, the provincial level in Madagascar, we were able, through that information, to detect early on a degradation of the food security situation of the population in advance of the more awareness of the drought and the extreme drought situation in the country. So very much using that high frequency data collection to be able to detect early on before the disaster hit, before the hazard hit. In that case, it was widespread drought in the southern part of Madagascar. And then in that case, as you see on the graph, is we're plotting through the combination of indicators collected through mobile phones. We are plotting and be able to represent the prevalence of insufficient food consumption. Next slide, please. In Mozambique, because of the access issue in the north due to the conflict, calling in those areas, we were able to still be able to collect information on food security in those particular areas that are out to reach. Next slide, please. In Central America, another click, please. There's, I think, another click, the strip, probably another one. Okay. In Central America, for example, in the context of the recurrent hurricanes and tropical cyclones that hit that region, there's a high frequency data collections in place to very much look at the in the right aftermath of the typhoons that hit the country, the change in the food security, to be able to determine the caseload, to be able to work with the disaster management office, and then be able to pinpoint and prepare better the response. Next slide, please. All right, another use of the real-time information. COVID has been one of them. So that high-frequency data collection has been in place in several countries. Afghanistan, I mentioned, not so much automated, but in place in Nepal. We're working on it in Myanmar. We've used it in Myanmar under COVID, and I mentioned the Pacific island countries. We've been able also to look at very specific targeted areas. And for example, in the Philippines, looking at the urban, peri-urban, in that case, was working with the government to be able to target better the poor, urban, poor in those urban, peri-urban. So the government was able to respond to the social protection system, whether in kind or cash. So there was an assessment of the new targeting, the new poor, the new food insecure. So the assessment side, but also we use the mobile technology to look at the PDM on how, once the distribution was done in kind or cash, how the beneficiaries have used that and the efficiency of that. And the last example is the hard to reach areas. For example, we're in discussion with Indonesia on Papua, and we're doing a feasibility of using the mobile phone technologies. Next, please. In the context of India, you will relate very much to this slide. There's existing capacities around mobile phone, ownership in the population, but at the same time also the data call centers, all that technology is out there. That technology is easier and faster to reach a large number of population. We heard the numbers from Mr. Pandey, huge numbers. Through mobile phones, we can cover a lot. It's all automated, speed, the cost effectiveness of doing that versus face-to-face, for example. Because it's all into a database, there's a lot of transparency about it, but also controls that need to be done around data protection. And the last one, there's easy integration because all these technologies speak to each other. So there's easy integration with already existing platforms, for example. Next, please. I believe it's my last slide. Potential challenges. If we look at the context of India again, language may be one. So data call centers need to be adapted. I'm sure it's not so much of an issue there. Also, the ability to call in the particular areas and target the right people. Sometimes mobile ownership doesn't match with the category of people we want to address. Also, if we want to be more specific about, looking at gender dynamics, how do we reach more women participants? And obviously, all this requires some good level of coordination. Next, I believe that was my last slide. Yeah. So that's in a nutshell all the work we've been doing, answering some of the key points and critical important points that were raised by the two previous speakers on technology, real time, to get information in the right place, right time. Thank you very much.
Thanks so much, Nico. Much appreciated. Moving on, so we can save time. Yumiko, please, over to you for your presentation.
Thank you, Eric. So then my presentation is about the real-time evaluation and learning systems. So Nicola just talked about real-time monitoring. So what is, next slide, please. So we need more, even more real-time monitoring evaluations. So what is then the real-time evaluations? So real-time evaluation is a timely and rapid and interactive peer review of the fast-evolving humanitarian operations. And it's broad. It has a broad objectives to capture the effectiveness and impact of the response, and to ensure that the findings are used for the immediate and organizational and operational change. So it is potentially very powerful and dynamic management tools that takes a wide-angle snapshot of the situation to assess and then adjust its response. So it can reinforce a link between the operations and the evaluation and policy formulation. So, so then what are the advantages of the real-time evaluation? The first thing is a timeliness. So the evaluation reports often comes too late to help the decision making. So real-time evaluation is undertaken in an early phase of an operation. So at the time when key operations and the policy decisions are being taken. And another thing is interactivity. So real-time evaluation is directly involved in the emergency planning process, and they also are engaged in sustained dialogues with the emergency staff and the field staff and headquarters. So to solve the common issue, for instance, monitoring data often fails to build stories and evidence stories, so and provide practical insights. So interactivity is another thing, and also perspectives. For real-time evaluation, able to approach an emergency from a number of different angles. So the more and more importance in real-time monitoring evaluation is important, especially on post-COVID-19. The need for real-time monitoring evaluation learning is even more important because traditional monitoring evaluation cannot handle the complexities or learning in the environment and human disasters. So real-time monitoring and evaluation is very critical for continuous impact learning. So it is important to enhance data efficiency by using remote data, digital tools such as Envam, Corvo tools, and Tableaus to get real-time impact measurement. So next slide, please. Then what is needed for real-time evaluation learning systems? So the first, I like to say the training and the capacity of field level staff. So providing monitoring evaluation training and enhancing the capacity of staff is important, particularly at the field level staff. they need to improve their understanding and performance. So then organization needs to help to develop their own set of skills and capabilities and systems. For instance, where and how to collect the data and the emergency context, and which monitoring and evaluation methods are appropriate, and how to combine the short-term focus and with more long-term sustainable change. So we should also bear in our mind that the stakeholders after post-COVID-19 is even more vulnerable than before. So field staff needs to work with these vulnerable people. And as another point is more confidence empowerment approach to change. So the both monitoring and evaluation have been facing the challenges of user information. So we can produce and analyze the data, but they are not really fully utilized. So I have discussed this with my colleagues. And then in case of monitoring, the people do not take the findings of the monitoring too seriously because there's no management response. And in case of evaluation, our people are very busy to feel the obligation to draft the management response and receive all approvals from the managers and staff. But as a result, no time to draft and no time to reflect and change the situation. And also in many organizations, monitoring evaluation staff is professional ranking is not so high. So they're not have no confidence or making decisions to change. So we need more confidence and empower the staff to change. And also about the systems, let's admit that we all have a pressure from the system. So we have corporate systems and guidance to follow, and which is great to standardize approach, but it's very difficult to shorten the feedback loops and learn from the present to cope with the new challenges. So I think it is a time to conceptualize the system well, what kind of M&D system we need, and then create more space for dialogues and learning. So next slide, please. So I'd like to share some cases which we're trying to do in the evaluation. So post-COVID time, and we work with even more vulnerable people, and we need real-time monitoring and evaluation. So data efficiencies can be improved by the techniques, using technologies. But when enhancing the efficiency, data efficiency, what do we really want to do? And what do we want to do with the time we saved? So I think that's the key thing is the stakeholder involvement. So that Mr. Pandey in his presentation, he said citizen participation and empowers citizens. So I think that's the key. So more participation, listen to the vulnerable people is more and more important. So I've been conducting a project called Evaluation. It is the combination of the visual thinking and evaluation facilitation. So not only taking the data and analyze it, but more encouraging to have a dialogue and being part of this process. So I have tested in Laos and Bangladesh and Myanmar and Sri Lanka where we conducted evaluations. So even the COVID-19 and travel restrictions, we've been using all these digital tools to conduct this evaluation. So, okay. So I've been trying to solve the typical problems of evaluation, such as information overload and complexity of information. But what I really want to do is engaging people and having dialogues among the stakeholders to find a solution and new ideas. So WFP is applying this, and the quality of evaluation is getting improved, and particularly the recommendations, which leads to follow-up and actions. So as a result, utility of the evaluations is improved, and then it's also communication tool to share the evaluation findings and the recommendation with the communities, so it's with affected population. So we use it as community feedback. So we can share the videos in YouTube of these workshops, and it's only 3 minutes video by all countries. And we've been recently produced a guidance and instruction videos about this evaluation. So we're going to advocate and then train people. Thank you.
Thank you so much, Yumiko. Quickly, because I know Mr. Pandey has to go soon, let's switch quickly to the questions. We have a question, Mr. Pandey. Is there a plan to have a real-time tracking of supply chain at every level? Can you answer that one for the group, please?
Yes, thank you very much, Eric. Fortunately, today, as was mentioned by Nicholas, from the supply side point of view, India has actually achieved a very major breakthrough. So, not only at every level, at the storage, transportation, and distribution, but even at the last point of the distribution level, real time monitoring is happening. Today, almost 75% distribution of the food grains is happening through biometrically authenticated system. So which means real time lifting of that food grain. One of the largest state of India, which is considered to be one of the seventh largest country in the world, Uttar Pradesh, is recording 99% biometrically authenticated distribution. Now we want to push all states to that level where every on the supply side entire food chain which is established gets monitored and real time basis. So this is happening, but Nicholas mentioned lot needs to be done actually on the demand side. So demand side, household level monitoring and evaluation on the real time basis is, I think, something where we would like to certainly work with our partners.
Thank you so much for your response. That is very inspiring. We have another question on, can we have a single portal exclusively for getting all the statistics on food production and distribution in India for and all over the world for government and common man usage? Christina, that's a big question. I think the government of India has quite a few good data portals on the government data. And so I don't know, Mr. Pandey, you want to talk about what's actually available for public usage, and then Nico for what's available globally for public use. Thank you.
Actually, most of the information, as you said, is available in public domain. On the production side data, it is available on the Ministry of Agriculture side. It's available in public domain. What is procured is available on the Food Corporation of India data. And in fact, as I said, all warehouses of the Food Corporation of India and most of the state government warehouses are also online. So we know exactly how much, I can tell you right now, how much food grain is lying in which godown in India. What is the exact quantity, so we can track it and we are putting all this in public domain. So we are improving this on a real-time basis further, and our effort is, say for example, for 1st of April, we are now going to supply fortified rice to all the integrated child development scheme centers and all the midday meal program, because micronutrient supply has been one of the concern on the nutritional security side. So we are going to cover entire network of the ICDS and schools for distribution of fortified rice. It's a massive effort. It's taking a lot of toll on the supply side, which was not fully ready, but they are trying to match up with the production of the fortified rice kernel, blending of that kernel, achieving and testing the right level of blending has been done. And also all states have been requested to put in place a evaluation system headed by the chief secretary of that state, which will monitor the outcome with the Department of Health in that state as to what is the impact of the supply of the fortified rice. So you must have also got to know, we have empowered individual citizen now. Just this beginning of this week, my department launched a very unique app which is available on Google Store. It is called Mera Ration, which means my food grain. So whatever the act empowers me as my entitlement, now I can download that app on my mobile, as Nicholas was saying, and I can see actually what is my entitlement, and I can draw it anywhere in the country from any distribution outlet.
Thank you so much, Mr. Pandey. Nicola, would you like to give a quick brief on what's available globally and where people can find that type of information?
So the information I presented from the demand side, the household level food security information, it's available publicly. So that's something that WFP offers under the name Hunger Map Live. So it's in the public domain. I mean, we can circulate the site, but definitely this is information that is out there. And has been used, we know, by by the media, by donors, for example, in their reports. And so definitely publicly. Then once the technology is there, once we work with the government, in terms of the, looking at the type of information to the right audience needs to be discussed. The user interface, what people want to see from this analysis, and that's something that could be, through the technology, obviously, customized to different audience with different access rights or something. But so far, what WFP has been doing around these high frequencies, very much to give visibility and information out there for the public good on food security.
Okay, thanks so much, Nicola. We have a question from Gaurav on network connectivity issues in hilly areas under PDS. I think we can maybe get to you directly, Gaurav, because I know that WFP is supporting the government in Uttarakhand, and that's part of one of the challenges. But I think that there is quite a bit of work that's been done in some of these hilly areas to manage it. So if we'll get a response to you later on that with my colleague Vijay. So Priyanka has an interesting question. And I think we think alike in some ways because I have my own opinions, Priyanka. But what are your thoughts on the use of Sentinel sites for tracking vulnerable houses in India? Any examples for the same? I think that, I don't know, Nico, I hate to come back to you on it. I'm a big fan of the whole Sentinel site approach, and I think it works for looking at trends. So Nico, do you want to maybe address that one?
No, I'm with you. I'm having worked in the health sector for a long time. I'm a big fan of Sentinel site surveillance, and I think this is definitely something we should see more outside the health sector, and in particular looking at around food security and nutrition. So definitely, I fully agree with Priyanka's comments. I think there's a value. It's cost effective. Gives you the right information for the right level of information that you need. But definitely, it's a great tool that we have not seen enough, I think, in the food security nutrition area.
Okay, thanks a lot. Good question. Harish is wanting to know, while food security is the primary concern, what can be done to improve dietary diversity of beneficiaries? And I mean, I'll step in on this one myself a little bit because I think that, as part of the discussion, and I think Mr. Pandey can also follow up on this, that, one of the government's response to COVID was to include pulses for a period of time in the public distribution system in order to improve dietary diversity of the PDS beneficiaries. But Mr. Pandey, are you leaving or do you have a second? You have a mask on, so. Do you have a second to address what can be done to improve dietary diversity? Sorry to bother.
Yes, sure, please.
So yeah, they're asking about, Harish is asking what can be done to improve dietary diversity of PDS beneficiaries. And I was saying that you had there was pulses there during the COVID response, but other things maybe.
Actually, during the COVID times, as you know, dietary diversity was addressed to some extent. Discussion is also happening with the states. And as you know, some of the states have already started distributing edible oil. And we are also, when we procure under the two schemes we have, one is the price stabilization fund and another is the PSS. Under these two schemes, when we procure oil seeds and pulses, they are also being given to states, and they are using that for distribution to their beneficiaries, who are not only NFSA beneficiaries but also the state ration card holders. But on institutional basis, this is an issue. We are working on Schedule 2 and Schedule 3 of the National Food Security Act, and hopefully in coming times government will take a view which will try to address these specific concerns.
Okay, thank you so much for that. That's very helpful. I think that we're gonna let you be able to go now, sir, if you need to go on to your next set of meetings. But we appreciate your attendance and your support in this.
Thank you very much, Eric, and thank you to all.
Thanks,
you.
take care. Bye-bye.
आप लोग ready sir?
Okay, Assad, can you get back to Christina and her question on where to find this portal for the information which was being was talked about by Mr. Pandey? And so I think also, sorry, between Nico and Yumiko for the next question by Hari Nilesh was asking about what resources for frameworks, etc., would you recommend for an organization that would like to build a frontline monitoring system? So any tools and resources, Nico, then Yumiko, if you want to make a suggestion for websites or agencies that are being leaders in this area. Over.
I mean, it's a monitoring system. You need to build your monitoring framework. So there is a lot of resources out there in terms of the indicators that would be needed to monitor the exact pathway that you want to look at. And I think there's it's a process. Understanding what outcome you want to address or outcome issues you want to address, and the pathway, and then the indicators along the way. So there are resources out there, whether coming from the if you're looking at food security, for example, nutrition, from combination of WHO, UNICEF, WFP. There's a lot of indicators that are available out there for looking at household level. We had the question on diet diversity. It's important to include that in your monitoring at household level. We've seen that, for example, with COVID, that with the assistance that was given to some of the poorest households, maybe food security was not perceived as an issue, but yet the distribution at the household level of the diet and the shifting to different diets has been an issue. So measuring all that. So there is, if you combine WHO, UNICEF, FAO for the agricultural production side, WFP, you have all the sets of indicators to help you, and rely on if you need on those agencies on the ground to help with the process, because again, it is a process to build your systems, and start with that. The technology will come. Just to say also that the way indicators are measured, when we look at a face-to-face measurement versus a mobile to get more agility, there's adjustment to be done to the types of indicators, the questionnaires, because you can't spend as much time on the phone questionnaire that you would do on a face-to-face. So there's some adjustment to be made, but I think there's a lot of resources out there.
Thank you, Nico. Okay, I hate to do this, but I think we have to do a quick wrap up before the next session starts. And it's not so easy to wrap up such a session. There was so much good information coming out. I'll go back to some points that Nico started with. That technology is a big thing, and it's necessary in doing this kind of work. But India is complex. It's huge. It's massive. It's complex. You have a large population. You have a lot of diversity. But so trying to do food security monitoring and nutrition monitoring in a complex country is going to be even more complex, because food security is not necessarily straightforward. It's multidimensional. It's not one single indicator to determine what and what are the issues and how to respond properly. Another point picked up is that though India is a leader in a lot of ways too. India is a leader in the green revolution, in the white revolution, the food production, becoming from deficit to a surplus producer. You have the largest food safety nets program in the world, with the public distribution system going from procurement all the way to distribution. So that's massive. And then there's the social safety nets are amazing, and they cover the needs of a lot of people. But as was pointed out, you have a lot of, let's say, supply side information, but not enough information coming from the demand side. And you have multiple systems in this country that, in related to the question, there's a lot of information coming in, but it's not always integrated and harmonized. So besides the need to have some primary data and having the citizens or the civil society or the communities providing information, there's also a need of linking that with what's coming from the reported side, and to understand the situation even better. So I mean, strengthening the systems, getting the system to talk to each other, coming up with integration and with a clear picture, using the technology that was being presented by Nicola, and then also looking at what are the results, because we don't often talk about is this what we're doing achieving the results, the desired results or the intended results. We know that we're doing a good thing, but are we making a difference? And if so, what can we do to strengthen it? And I think that the real-time evaluation that was being discussed was very important, and also linking to what Major General was talking about in terms of the need for information for addressing needs that are created through humanitarian crises or emergencies is super important as well, because not one size fits all. And sometimes you have to tailor a response. You have to tailor it by duration, by the type of response, and who you're responding to. So that kind of information is very, very important. So I think, and the last point was talking about, what I thought about. Nico mentioned something about hotspots. But in India, you have these aspirational districts, and Niti Aayog has done a lot to try to set up monitoring, to try to motivate leadership in the aspirational districts to improve the situation for the citizens of those districts across the country. And that, we talked about sentinel sites, we talked about a lot of things, but I think, you still have hotspots. You still need to take a closer look at aspirational districts, maybe other disadvantaged population groups, urban areas. We don't have enough information. We think they're under our nose. We don't necessarily need to reach them, but they're also hard to reach in a different way. I mean, they might be close by, but it's hard to find people sometimes in urban areas. So I think, there's a lot to do. There's a lot we need to think about. And I think the general consensus is that information is useful. There's a need to integrate it. And I think we can do more in terms of looking at the supply side. The demand side of the information and linking it up with the supply side. So with that, I will close the session. I thank you, all of the panelists. I thank Niti Aayog, DMEO, for allowing us to do the session. And thank you all for attending the session. And thank you so much. And good luck with the next sessions. Bye-bye.